Thanks so much, and thank you for being here today. I will be talking about parent-focused prevention of child sexual abuse, and this is work I'm doing together with Elizabeth Latorno. So this is work in development, so a lot of what I'm going to talk about today is around our work. A lot of what I'm going to talk about is why is it important to work with parents and some of the considerations for how to implement programs with a parent-focused prevention angle. And then I'll tell you a little bit about the curriculum that Elizabeth and I are developing and some of the next steps in this work to refine the program and evaluate it. So this figure is adapted from Bronfenbrenner's social ecological framework, and I put this up there to highlight how each of us as individuals is really embedded in a system of different levels of social ecology, right? So ranging from the close factors like our families to more distal ones like policy and culture. And our current responses to child sexual abuse really target different of these levels, but one area that's been relatively neglected are parents or caretakers of children. And we believe that this is a really important area to develop as a prevention focus, and a really comprehensive approach to prevention of child sexual abuse will need to involve multiple levels, but parents can be potentially a very important piece of that bigger picture. So we've already talked quite a lot about the justice system. One thing that's, I think, important to highlight is when we're thinking about prevention, most offenders don't have a prior history. So one study showed that over 90% of individuals who were serving time for child sexual abuse offenses had never committed any sort of related offense in the past. And repeat offenses are actually lower for child sexual abuse offenders than for other sorts of perpetrators. So it's important to keep that in mind, because although much of our efforts are going into working with these offenders, when we think about trying to prevent new cases, we need to be thinking more broadly, because we're not necessarily going to be impacting other folks who are at risk for offending. Another reason parents are so important is that they're so proximal, right? Parents are around, and most child sexual abuse, as we've heard, is perpetrated not by strangers, but by individuals who are actually well known to the family. So whether it's a step-parent, uncle, a friend, these are very, very common occurrences. And parents have a gatekeeping role in terms of who comes into the home, who spends time with the child. So making parents more alert to these kinds of issues can really encourage them to take different kinds of protective measures. So ideally, we would want to have a program that's flexible enough to be able to work with a very wide range of families. But when we think about where to start, families that are at higher risk are a very promising place to start. Now, there is no sort of robust risk marker for knowing when a family is likely to have a child sexual abuse occur, but there are some characteristics that have been associated with higher risk, and I've listed a lot of the most common ones up here: having only one biological parent in the home, fighting or violence between caretakers, parent substance abuse, low maternal education, poverty, lack of stable child caretaker bonds, maternal mental health issues and child sexual abuse histories, which has come up already. Child disability is also an issue that makes children very vulnerable, and research has shown that these children are at higher risk for being exposed to child sexual abuse. So in terms of the curriculum we've developed, it has 4 key sort of chunks or modules in it. The first is around basic knowledge. What is child sexual abuse and inappropriate sexual behavior with children? How can you as a parent help prevent them? And I should note that this is not only around prevention of one's child being victimized, but also if one's child is showing evidence of inappropriate sexual behavior with other children, how can one respond to that? Parts 2 and 3, in a way, are really the meat of this intervention, because this is the piece that we feel parents need more specific skills in than what they might be able to find online. And this is around communication, talking to your child, and safety monitoring. Finally, the fourth chunk is around making a report and how parents could go about reporting suspected abuse of their own child or another child. And there are a number of possible modalities that we're considering at this point. Again, these modalities are going to depend a lot on our partnerships with different organizations and the types of families we work with. Online training, as I mentioned, may be a way of reaching a lot of people very broadly, but with less individualized support. One thing that we're very intrigued by is the notion of online training with Skype feedback from a professional online, where parents could actually get some direct sort of real-time feedback on how they're doing with skills. One-on-one training is also an option, particularly with people who provide services to families, such as home visitors and advocates who often have really close relationships with families. And group formats are another way of reaching folks. So in summary, child sexual abuse, as you've already heard from others today, we believe it's preventable and that is an achievable goal, and that focusing on parent-based prevention strategies is a really promising way to move the prevention agenda forward. We believe parent-focused prevention can also ultimately be really well integrated with prevention approaches at the school, the community, and the society levels.